Joanne. Is it on? Yeah, it is. Thank you to the organizing and scientific committee for the opportunity to present these findings. I have nothing to disclose. So there have been quite a few systematic reviews in recent years looking at return to sport following a hip arthroscopy for FAI. And what is quite clear from these studies are that the majority of athletes seem to go back to sport. However, what's less clear when we look into the individual studies is what kind of return to sport are we talking about. So there's very rarely a clear distinction between return to any sport, return to pre-injury sport, or even return to pre-injury sport at pre-injury level, which is often the most important parameter for the athlete. And then also, which has been highlighted, sports performance is rarely reported in this population. So the purpose of this study was to investigate the rate of return to pre-injury sport and pre-injury level and performance in athletes who have had a hip arthroscopy for FAI syndrome. We took advantage of the Danish Hip Arthroscopy Registry, which is a nationwide database with prospective registration of hip arthroscopies performed in Denmark. So we recruited subjects from there between 18 and 30 years old, as we believe that this age group were the one most likely to be engaged in sport. All of these subjects had a hip arthroscopy and were treated for FAI, and they had a cam resection and a labral surgery as the two minimum procedures. We did not include subjects with severe cartilage damage or very narrow joint space width, as we know that these factors are associated with a worse outcome. These subjects were then invited to answer a return to sport questionnaire, which was developed in accordance with the return to sport consensus statement. It was pilot tested based on telephone interviews at our department prior to study initiation. So it gathered information on pre-injury and present sport activity, including the level of play. And then we defined return to sport or return to play as being engaged in the pre-injury sport at pre-injury level at the time of follow-up. If subjects reported that they were playing their pre-injury sport at pre-injury level, we asked them to rate their self-reported performance and participation. And again, this was assessed in accordance with the consensus statement. So subjects reported whether they had optimal performance and full participation in the sport, impaired performance but still participating fully in the sport, or impaired performance and restricted participation. And restricted refers to not being able to compete in all aspects of the sport. We also measured self-reported hip and groin function using the Hager's questionnaire. So we identified 350 subjects which received the questionnaire. And then we had a response rate of about 65%. And of those that responded, we included 189 athletes. The main reason for not being included in the study, despite responding the questionnaire, was if a subject did not participate in sport prior to initial onset of hip and groin pain, or if a subject did not intend to go back to their pre-injury sport at pre-injury level following the surgery. So these 189 athletes are all athletes that intended to go back. They were included at a mean follow-up time of 33 months post-surgery, which is in correspondence with the existing literature. The mean age was about 23, 24 years old, and we found no difference between those athletes that we included and those that did not respond in terms of age, follow-up time, and radiological and operative data. So if we look at our primary outcome, we found that 57% of athletes were engaged in their pre-injury sport at pre-injury level at the time of follow-up. We then investigated whether the type of sport, the time to follow-up, or the level of play influenced these numbers, but we did not find any association between these variables and the rate of return to pre-injury sport at pre-injury level. If we look a little bit more closely into this group of these 57%, this is how they rated their performance. So 1 in 3 athletes had optimal performance and full participation, whereas almost half of the athletes had impaired performance and restricted participations. So even though that they were considered playing their pre-injury sport at pre-injury level, they were not fully able to participate in all aspects of the sport. So we then asked the question whether persistent hip and groin pain was the main reason for not going back to pre-injury sport at pre-injury level, or not reaching optimal performance, since other factors may come into play as well. For the majority of athletes, persistent hip and groin pain was labeled as the main reason for this. And just to show how self-reported hip and groin function may drive sports performance following a surgery, this is the group that reported optimal performance. Here I have the 6 subscales and a scale from 0 to 100, 100 being no hip and groin problems, 0 being severe hip and groin problems. So the group with optimal performance had almost perfect Hager scores. The group with impaired performance but still full participation had a little bit lower scores. And then if we look at the 2 groups, which this group here restricted participation, so these are still returned to sport. And then the group here which did not play pre-injury sport at pre-injury level, we see that those are severely limited in their hip and groin function. So the take home is that when we use a very clear definition of return to sport, being return to pre-injury sport at pre-injury level, we found that 57% of athletes go back to sport. And 1 in 3 of those athletes can expect to reach optimal performance, and that's about 1 in 5 athletes, or 20% of the total cohort that have the surgery. So I would like to thank the Danish team behind me and the steering committee for allowing me access to patient records. Thank you.